good afternoon. Welcome to the program. It is good to have your company. I'm Duncan Garner, New Zealand, and you are with Radio Live Drive. Well, today on the program, when alternative medicine goes horribly wrong, when a cancerous lesion grows from 2 centimetres to 20 centimetres and then the patient dies, it becomes all too late. Why this practitioner from Te Horo, north of Wellington, should be facing a manslaughter charge.
I think she actually talked to the tumour and asked it to go away. So, I mean, it's just beyond nutty. And people will say, well, what was this poor lady with cancer going to see this person for? But again, having spoke to hundreds of people with cancer, I understand it. People can be desperate, so I would never blame the patient in this situation.
Yeah, this is a very desperate case. Of course, it's all too late because Yvonne Main is now dead, but it's a bit of a warning, this interview. It's a warning, this interview in a second, that if you are in alternative treatment, you may want to listen very shortly to Shaun Holt, Professor Shaun Holt, because you may just learn something about alternative medicines. And I'll tell you what, it's quite scary out there. All right, just gone 14 minutes after 3. It is good to have your company. Yvonne Main died in June 2010, but by the time she went and saw a surgeon about this yawning wound in her head, it became so big her brain was actually exposed. She had this cancerous lesion, and it had grown from about 2 centimetres to 20 centimetres during 16 months of treatment by an unqualified iridologist. An unqualified iridologist who happened to come from Te Horo, north of Wellington. The iridologist's name was Ruth Nelson, and she is appearing before the tribunal in a case brought by the Office of the Health and Disability Commissioner. The worst thing about this is that all the experts said that this tumour, if you like, or lesion could have been dealt with by normal or conventional medicine. And what they ended up doing was applying herbal oils and all sorts of things to her. And they also tried emotional freedom tapping of her forehead to try and get rid of this lesion. Completely loopy kind of stuff. But this is happening in New Zealand, and there's an iridologist in most towns, provinces, cities around New Zealand. Professor Shaun Holt is the adjunct professor at Victoria University, an expert on complementary medicines, alternative medicines, if you like, and he has some real warnings and joins us now. Shaun, appreciate your time this afternoon. What are your thoughts on the case?
Yeah, unfortunately, this is a tragic case, which we've seen in the past, and I'm sure we'll see in the future. We have armies of alternative therapists out there without sufficient skills or knowledge to be treating people, yet treat people they do. They usually do it badly, and it can turn out very badly indeed.
So are there any alternative therapists or people involved in this kind of medicine that we can actually trust, or is it something that we need to keep away from?
There are hundreds, if not thousands, of alternative therapies out there, and it's a mixed bag, and I'd say the vast majority are not going to help people or could even be harmful, but there are some useful therapies and products in there as well, and it is very hard for the public to know which ones are good. For example, I have a big interest in people with cancer who are using alternative therapies, because most people with cancer either use them or will have a good look at them, and I fully understand that. I probably would, I'm sure I would do myself, but it's very hard to know which ones you can trust and which ones you can't.
Just let's go back to the start of this. An iridologist. What actually is an iridologist?
An iridologist, or iridology, is one of the most ridiculous of alternative medicines. They claim that they can look into people's eyes, see what is going on in the body, work out which part of the body is diseased, and from then on they'll recommend various unproven treatments. So it is one of the worst classes of alternative medicine. And
do we have many of these sorts of practitioners in New Zealand?
It's hard to say the exact numbers because there's no registration or formal body, but every major town in New Zealand would have quite a few people who are doing iridology. And what happens is that a lot of alternative practitioners will do iridology as part of a suite of therapies that they will offer. So they may offer homeopathy, and naturopathy, reflexology, all these other things as well. So
if you've got serious cancer or something you think is serious, your advice is to go to a medical practitioner rather than someone like this?
Absolutely. And I understand, though, why people would want alternative things as well, or or we like to say complementary, use them along with your standard cancer treatments. And there are many that are useful. Now, none of these are going to cure you, but they may be helpful in terms of quality of life. And I'm talking about things like yoga, art therapy, certain herbs and vitamins that can help with some of your symptoms or energy levels and this sort of thing. And a lot of doctors now and cancer nurses as well will tell you which ones are useful and which aren't.
And that's the thing, I suppose, is people listening to this interview this afternoon wondering, is there some kind of website or is there somewhere they can go to, Shaun, that says, yes, this is okay, this can work, this can't, stay away from these types of people and medicines?
Yeah, there is. The one website I do recommend strongly is the Mayo Clinic. That's a famous Mayo Clinic in America. I know the director of complementary medicine as well. They have an excellent website. You can trust all the information there. Locally, I'm not here to sell my own things, but I do have a book on the subject, which is done really well, and I give talks to all the cancer doctors and nurses, and also hold sessions for cancer patients as well, where I go through what are the good and what are the bad, and how we decide.
Are there some patients with tumours and with cancers that actually can be and have been saved by alternative medicines?
No. There are some natural products that have been shown to cure cancer, but those of them, such as Taxol, which is a natural product from the yew tree. But then, of course, we've made that into a pharmaceutical, and cancer doctors will give that to the patients. So anything like that has been incorporated into medicine. So there's definitely no cures out there. What there may be is a few things that can help with quality of life and reducing your symptoms, which is important as well. But if anyone hears of an alternative practitioner offering a cure, I can guarantee them that they will not do so.
It's interesting with this iridologist, and just reading through some of the notes of what she was involved in. She has no qualifications, not a registered natural health practitioner at all. She scraped and picked at this wound, if you like, or this tumour. She discouraged the patient from visiting a doctor, and she was involved in, quote, emotional freedom tapping. It just sounds loopy.
Yeah, the latter one, I think she actually talked to the tumour and asked it to go away. So, I mean, it's just beyond nutty. And people will say, well, what was this poor lady with cancer going to see this person for? But again, having spoke to hundreds of people with cancer, I understand it. People can be desperate, so I would never blame the patient in this situation. And now, preempting one of your next questions, what can we do about this? Do we need laws? Do we need regulations? Or what I would argue, and I argued last year when the case first came to light, is why don't we use existing laws? And I'm a doctor, of course, I'm not a lawyer, but for the life of me, I can't see why this person has not been charged with manslaughter.
Well, that's right. I mean, that was my next question, is not only what can we not do about it, but what laws do we need to actually target some of these people who, and I want to be quite honest here, seem to be preying on people's fears?
They do, and look, there's two types of alternative practitioner out there. Some of them are deliberate fraudsters who prey on people and want to take their money because they're vulnerable. But that's actually the smaller category, and I have to say, even though I don't condone what they're doing, most people, almost certainly like this iridologist, they genuinely believe in what they're doing. They really think they're helping people. But regardless, the outcomes can be terrible. Do we need new laws? As I say, I'm not a lawyer, but this seems like a clear-cut case of manslaughter to me, where a person was effectively killed, even though there was no malice in there, so it's not murder. But instead, it's gone to the Human Rights Review Tribunal, and I looked that up today. The highest compensation they've ever awarded is $40,000, and of course that's not much use to the person who's deceased. And the other thing they can do is order remedial medical training. Well, again, that's not going to help in this case of an iridologist who has no skills whatsoever.
So you're quite clear in this case that there should be some kind of manslaughter or medical manslaughter charge here.
Yeah, with the qualification that I'm not a lawyer, but that's what it would seem to me. It seems just to take someone to a tribunal and to give effectively a rap over the knuckles as the main outcome seems ridiculous. By way of example, there was some parents in Australia, in Sydney, a couple of years ago, and their baby died from eczema because they treated the baby with homeopathy. And you might say, well, how can a baby even die from eczema? But if you're totally neglected, you can get infected, and the poor baby died. And yes, her parents were charged with manslaughter, and they were jailed. And I think that's one of the best things we can do if we send out a strong message to some of these alternative therapists that if you neglectfully give dangerous advice and people die, you will go to jail, then maybe they'll tamper down what they're doing.
Interesting call, isn't it? I appreciate your time, Professor Shaun Holt. What do you think of this? Do you think we need to change the law, beef up our laws, and hold people to account like this iridologist, Ruth Nelson? And if you're in and around Wellington and use her, just take this as a warning. Take it as a warning from me, because this is a woman who's in front of the authorities right now. What do you think we should do? Should we change the laws to make these people far more accountable? Right now, all they can do is face some fines. What about manslaughter? What about manslaughter? What do you make of that? 3920, you can text me, keyword is live, or Garner at radiolive.co.nz. Have you had a bad experience with some of these alternative practitioners, if you like? Let me know, Garner